Can't help everybody, believe it or not. Okay? But for the most part, we all have ailments that I can help with. And they just don't know that. Because what does the chiropractor do? What does he adjust? Does he adjust just the neck and back? No. We adjust everything that we can adjust. There's a joint too that's related to something. Because your nervous system runs your whole body. So let's go through a couple of scenarios, let's say. And again, Mike, thanks again for the referral. Ben's card passed out. Okay. Every time I go somewhere, this isn't an ego thing. When you walk into a party and they go, oh, this is a chiropractor. Boom. Right away, someone wants to ask you a question.
Mm-hmm. Yeah.
Every single time. If I walked in and said, oh, this guy's a painter, they're not asking me questions. They're like, okay, great. Okay, he's a painter. Okay, whatever. They always want to tell me their problem.
I have another scenario, but.
Oh, Jake, wasn't talking about you, Jake. Anyway, so I walk in today, two people, again, ask me a question as soon as I walk in the door. One is about stretching, which you need to do. It's super important. I used to give a 30-page pamphlet to every new patient. I gave it up in the trash all the time. Keep it simple, stupid, whatever that is. Do something light, easy. How do I do this? How do I do that? First of all, there's something called Google, okay? And you can just push in an exercise for your back, your neck, your arm, your shoulder, your hip, anything, and it tells you what to do. It's simple, okay? And it's easy. Take a minute, do that all the time, okay? So stretching is super important. Am I doing it wrong? Most of the time, maybe, and your technique's probably not perfect, but at least you're stretching, you're doing something to get there. Patient goes, when I do this, I have pain down my leg. Yeah, you dummy, because you're tight, okay? And you need to stretch that out. I didn't say dummy. But stretching is super important. We're not, except for Jordan, we're not 29 anymore, okay? So things change as we get older, and you have to start taking care of it. If you don't take care of it now, you have to take care of it later. I've always said that. An old Ames commercial, if you remember that, right, Jim? Ames? Yeah. Okay, another thing, recovery. Your recovery, we're all asking about recovery. When you have a problem, sprain, strain, you have to recover from anything, especially right now. You're not 29, well, you might be 29. You're not 29 anymore, so your body takes time to recover. Take care of it because it's going to build up scar tissue and everything else, and if you don't do it now, again, you'll have effects of it later. Shoulder, guy asked me about shoulder stuff. Probably the only place in the body that does not have a joint that's connected. There's 3 bones that sit here and they're wrapped up with a bunch of rotator cuff muscles. So super important, this is why you can do everything with your arm. That's what it's designed to do. But there's always a problem there. Torn labrums, rotator cuff tears, wear and tear, arthritis. We're all gonna get that, believe it or not, that's just aging process. And what you try to do is just try to keep that, again, mobile is possible, and supplements to help your body recover. The biggest thing I found out in stretching for shoulder, you take a soup can, just think this is a soup can, it weighs a pound. You're on the counter, you bend over, and you just do circles like this. Okay, so what it does, it separates the joint that's not there, but the 3 bones that are connected here, and it just stretches and moves the rotator cuff. Probably the best exercise I've ever given anybody over 50 years old.
Wow.
These seniors would come and go, oh my gosh, I can't believe you told me to do something. And it worked. I don't know, I can't remember where I got it from, but it's the simplest exercise ever for a shoulder because it's complicated. And then last but not least, hip problems. That has to do with your alignment of how I'm standing and how even I am here. Do I have 20 pounds on this side, 20 pounds on this side, okay? Years and years and years, another patient of ours, it's a young man, had hip replacement surgery after years of chiropractic care. Oh, I'm gonna fix you, I'm gonna fix you, I'm gonna fix you, I'm gonna fix you. Am I gonna fix you? I don't know. Am I gonna prolong it? Maybe. Am I gonna maintain it, stabilize it? That's what I want to do. Eventually, he had to have hip surgery, and now he's 29 again. So that's gonna happen. You're gonna wear out. People at 16 come in and go, I've never had this before. Yeah, I know.
It sucks
Okay,
getting old.
they said it's time to start feeling what you've done for the last 55 years. Anyway, so it goes on and on and on. I'm asking you 2 things. Write a review for me if you can online, and 2 if not, and pass out a card to someone you think might need some help. Any questions?
Sure.
All right, thank you for your
Awesome.
time. Jeff Salo, I got your back. Thank you.